Hello, I'm Idaho State Representative Heather Scott from District 1, and I just wanted to briefly do this video on a decision made by Panhandle Health District. They recently passed what they are calling an emergency restriction order. And what they're saying, the order is for Kootenai County, Idaho, and they are saying that if you are in public and you cannot social distance, you have to wear a mask that completely covers your nose and your mouth. And I spoke with a doctor from my district who attended the meeting. So the Panhandle Health District voted on this, and this has passed. And so I actually have him on the line. And doctor, are you there?
Yes, I am.
So can you tell us a little bit, without revealing who you are, can you just share a little bit about your credibility? And then I have a few questions for you.
Sure. Well, I'm a physician, and I've been in practice for almost 20 years, and have a lot of experience in the emergency room, and I've treated COVID patients more specifically and recently. And I'm a concerned citizen and a concerned physician about what I witnessed yesterday at the Panhandle District has me very concerned regarding the mandatory mask mandate from the Panhandle Health District to Kootenai County.
So you were sharing with me, I guess, how you said that a mask is a medical device. What does that even mean? I don't think of a mask as a medical device.
Well, pretty simply, any kind of a facial covering or a mask, like we've been talking about, no matter what it is, if you say that it is intended and being used to be treating or to be preventing a disease, i.e. preventing COVID, the U.S. Department of Health and Human Services, May 2020, Guidance for a Federal Drug Administration, would classify that item as a Class 1 medical device. If you're using it, that same exact bandana or mask that you could get at Home Depot or what have you to do construction, it's not a medical device unless you label it to prevent or to treat a condition or a disease. Now, all of a sudden, you're going to be under the classification of a Class 1 medical device under the jurisdiction and monitoring of the FDA. That's why when you buy a mask at the store, it says, caution, this is not intended to treat or prevent disease, because they do not want to be under a medical device. This is just whatever. I'm wearing it for a costume, or I'm wearing it for my job at the construction site. It's a completely different ballgame when you say, put this mask on or cover your face to prevent or treat a disease. Boom, now you got a medical device.
So I'm looking at a picture of 7 board of directors, the current board of directors that made this decision, and some voted no, but the majority voted yes. Would you say, could they be practicing medicine? Does it seem like they're practicing medicine by doing what they're doing?
Right. So as soon as because I'm in the ER, and so I use masks as a tool, as a medical device every day, and it's very obvious to me that it's a medical device. And when people are just casually talking about covering your face or whatever, I use it in the ER, and I know how you can adjust or modulate somebody's carbon dioxide levels. It changes how they think. If you have somebody who has a restricted airway or COPD or emphysema, they can build up carbon dioxide very quickly, and they get confused days. They can go unresponsive, stop breathing. So if you trap carbon dioxide or if you expel it, and if you use a tool to treat a disease, i.e. to prevent COVID or expel or trap carbon dioxide for whatever reason using a face mask, and if you instruct somebody to put on a mask to prevent a disease, well, you've now jumped into my world of practicing medicine, using a device on purpose to treat a condition or to prevent a disease. That's the practice of medicine. If you look up the Idaho Code for the medical board, it says specifically, you can look it up, the practice of medicine is, quote, to investigate, diagnose, treat, correct, prescribe for any human condition, ailment, injury, infirmity, deformity, or other condition, physical or mental, by any means or instrument. So a mask, and you're using it to treat or prevent a disease. You are now practicing medicine. My question was, can a board or a committee or a health district quote, practice medicine, I look up the Idaho state laws and titles, and it only identifies an individual that can practice medicine. It says nothing that a board group or a committee or any kind of a body or entity can practice medicine. Only a person can. So that got me very concerned.
Well, you know, some of these people on this board have no medical background. They are county commissioners, so
Exactly.
that's crazy.
It is. It's unbelievable. And honestly, if you're a physician or a licensed healthcare worker and you're on the board, you might be held to a higher standard because you are trained and educated in the practice of medicine, as opposed to a non-medical person who's just on a board or a committee, for which health districts and other committees typically they're not asked to make a decision on practicing medicine. And that's why I think there was a big discomfort and uneasiness there, because they're being asked to do something they shouldn't be doing possibly.
So you were saying something about forcing treatment, and even as a doctor, you can't force treatment on somebody. Can you tell me what that means?
Sure. So I was just imagining, if you want to illustrate, imagine the Panhandle Health District as the quote doctor practicing medicine using a medical device to treat or prevent a disease. Well, the patient is Panhandle. The people of North Idaho in the Panhandle District, that's the patient. If the people of the patient does not want to or consent to a medical treatment, even if it's good for them and it's the right treatment that will help them, if you don't volunteer and consent, you have now battered that person. You have maybe committed negligence. If I have, as a doctor, was talking to you in my office and I said, help keep you safe and protect you from getting a disease, and you say, no thank you, doctor, and then we discuss the risks, we discuss the benefits. What can happen if I wear a mask? Well, if you're driving, you get dizzy, you're lightheaded, you might get an accident, you might crash, I don't know what's going to happen, maybe you don't know to take it off in time, you can get headaches, I'm not sure, so here's the risk, here's the benefit, you might not get COVID, you might not spread it to somebody else. And then if you say, no thank you, doc, I don't want to do that, and I say, I'm going to force it on you anyway, you can sue me for civil negligence, or you can sue me for criminal battery or gross negligence, depending on how harmful it was. That's part of the code. And the Idaho law, it has well written and well established. I hope there's lawyers out there listening that can help, but I'm concerned that it violates the Idaho common law right to self-determination. And that is a very fundamental human right to self-determine. If you're of sound mind, you're competent, and you're an adult, to self-determine what medical treatment is on or in your body. That's a final decision.
Boy, it almost seems like I can't seem to get a clear answer. Does this help? Does this not help? This study says this study says something else. Do you have any thoughts on that?
Well, we don't know. The short answer is we don't know. It's a novel virus, which means novel is new. Coronavirus 19, we've never experienced anything like this before. Part of the reason I'm also concerned about mandating a certain one type of medical treatment is that we, at the beginning of this epidemic in the medical community, we were told in the ER that COVID patients, they come in, they have difficulty breathing, respiratory distress, hypoxemia, that means low oxygen levels, and to intubate early to protect their airway. Well, it turns out that advice early on, because this is a new disease, we don't know what works best, that advice to intubate a patient up front and early on presentation was actually causing more harm and killing more people than it was helping. And so what are we doing now, and what advice are we going to give now that in 6 months or 3 months next year, because people are monitoring, keeping track of the data, and there's going to be scientists, epidemiologists, statisticians, physicians that are going to look at each county in each city across the state and country and find out, hey, where the mandates were, was it more effective? We don't know. So the short answer is, I possibly have the question, is this considered, if it's a medical treatment, is this considered medical experimentation? And everyone knows, and we have a very valuable lesson in history, on the Nuremberg trials after World War II, what we took away from that for the world, a human right violation, is medical experimentation without 100% informed voluntary consent to that medical experiment. So if this is medical experimentation, obviously if it's a mandate, there's no consent to it. So a lot of the people didn't consent. They weren't given risks and benefits and alternatives. They weren't allowed to opt out. It's just blanket medical treatment, and we don't know what the standard of care is. There is no, when there's COVID-19 in the general population, here's what you do, and this is what works best and causes the least harm. There isn't that. We don't know. That's what makes me very nervous.
Well, it almost seems like we're guinea pigs here.
Exactly, and I'm wondering if there are, laws sometimes are helpful, sometimes they're hurtful, sometimes they're illegal or unconstitutional. They violate a state law, a human rights law. I don't know, but it makes me think about the Wisconsin. I believe it was Wisconsin state. I think came from the governor, and there was a mask mandate. But the state got sued. They took it to court, and it went all the way to court, and they had to overturn because according to however the laws were written in Wisconsin, they could not mandate mask use. And I'm wondering, is there case law now there? I don't know what reason it was unconstitutional according to their state law, but it was overturned. They were not allowed to mandate masks, so they can recommend, but you can't force.
Well, so I'll just leave the listeners with this. So, this is unconstitutional. We live in a free society. You cannot force citizens. You can't require people to do things. You're taking away their life, their liberty. You just can't do that. And ultimately, we need to know our rights. We need to stand up for our rights. And we need to be willing that we need to stand firm when we have unconstitutional sheriff, or we have police forces that are going to enforce unconstitutional law, or edicts or orders. So I encourage you to stand firm, unite. Let's start looking into this health board. I've been looking into that a little bit. It's regional government. You need to understand regional government, how these people get on this board, and how we can use our commissioners to remove them from the board. And the other thing is they are funded by our counties. And so they're taking our tax money from our county, everybody's properties tax. I've been getting lots of calls on that. We're funding this. We're funding them to take away our life, our liberty. And so I encourage you to get involved. Doctor, I sure appreciate you joining us, and I may be calling you back with more questions, so I appreciate your time.
Oh, it's my pleasure. And I just want to be clear, just to want to state, I'm not saying anything. I'm not saying pro-mask. I'm not saying anti-mask. I'm saying, like you said, it is each person's individual right to make a decision on what's best for themselves. And if it's medically related to treat a condition, it should be done under the supervision of a physician. I'm not taking a stand one way or the other, except for your individual rights, and I'm trying to protect that in my patients. So I thank you so much for what you're doing, Heather. Yeah.
Well, thank you. And, unfortunately, it's probably going to take legal action to stop this overreach. And so we'll see what happens, and just thank you all for listening. Bye.